Earlier this week, Canada lost its measles elimination status, which some health experts have described as a wake-up call.
Measles is making a big comeback, a dangerous comeback in Canada, with cases at like a 30-year high. So now the Canadian public health people say it's no longer considered eliminated.
Canada has lost its measles elimination status.
Canada has lost its measles-free status after nearly 30 years.
Canada has lost its measles elimination status.
On November 10th, 2025, the Pan-American Health Organization announced that Canada had lost its measles elimination status.
Last week, PAHO's Measles, Rubella, and Congenital Rubella Syndrome Elimination Regional Monitoring and Re-Verification Commission met to review the most recent epidemiological situation in countries of the region of the Americas. The Commission concluded and made a recommendation that I accepted, that the endemic transmission of measles has been re-established in Canada.
That's Dr. Jarbas Barbosa, PAHO's director. Canada first eliminated measles in 1998, 27 years ago. Since October 2024, more than 5,100 measles cases have been confirmed across 9 provinces and 1 territory. Two infants infected before birth died after being delivered prematurely. 27 years, gone in 12 months. To lose elimination status, measles must spread person to person for more than 12 consecutive months with the same virus strain. In 2016, the entire Americas region, 35 countries from Canada to Argentina, was declared measles-free. First WHO region ever to achieve it. Venezuela lost status in 2018, Brazil in 2019. Both regained it in 2024, but it took around 5 years. Now Canada joins that list. And because one country lost status, the entire Americas region loses it too. The outbreak started with one person at a wedding. October 27th, 2024. An international traveler attended a wedding in New Brunswick. They did not know they were infected yet. New Brunswick contained its cases by January, but guests had already traveled home to Ontario, where the virus found communities with lower vaccination coverage. Between 2020 and 2023, Canada recorded 16 measles cases total. In 2024, that jumped to over 100. By November 2025, more than 5,000. Measles is one of the most contagious viruses known. One infected person can transmit it up to 18 others. The virus can remain infectious in the air for up to 2 hours after someone leaves a room. To understand why Canada losing its status is so dangerous, we have to look at the pathophysiology, the biological mechanism of the disease. Measles is a master of what's called viral entry. It uses a surface protein called hemagglutinin, the H protein, to find a specific receptor on your immune cells called CD150. Think of the H protein as a master key and the CD150 as a lock that guards the most important cells in your body. Once it's inside, that's when the virus performs its most devastating trick. Immune amnesia. What it does, it infects your memory B and T cells. These are the cells that store the blueprints on how to fight every other disease you've ever encountered. By destroying these cells, measles effectively wipes your immune system's hard drive. A child who recovers from measles might be physically fine, but their immune system is back to day one. For the next 2 to 3 years, they are significantly more vulnerable to secondary infections like pneumonia or influenza because their body has literally forgotten how to fight them. Measles requires 95% vaccination coverage to prevent outbreaks. In Canada, coverage for 2-year-olds dropped from 90% in 2019 to just 82% in 2023. For the second dose, it fell from 86% to 76%. 8% doesn't sound like much. But it's the difference between containment and catastrophe. The pandemic disrupted everything. Clinics closed, parents delayed visits, thousands of children missed vaccinations. Dr. Don Bowdish, immunologist at McMaster University, explained the systemic problems. Cuts to public health funding, the lack of a national vaccine registry, and a shortage of family doctors, all while misinformation about vaccines is circulating widely, have contributed to the rise of measles. If families don't have a primary care doctor or nurse practitioner, their kids are at risk of missing vaccinations since pharmacies don't do measles, mumps, or rubella immunizations for very young children. Inevitably, if you don't have good, consistent care, these are the kinds of things that get dropped. For the millions of Canadians without a family doctor, accessing childhood vaccinations became difficult. And misinformation spread. False claims that measles isn't serious or that the MMR vaccine is dangerous gained traction online. Public figures, including U.S. Health Secretary Robert F. Kennedy Jr., promoted anti-vaccine claims. Trust in public health institutions declined. A 2022 study found Canadians aged 12 to 19 had the lowest immunity, only 78.7%. These were not random gaps. They were concentrated in specific communities, and it just so happened that measles found them. 2 pregnant women contracted measles during the outbreak. The virus crossed the placenta. Both women went into premature labor. Both infants died shortly after birth. One in Alberta, one in Ontario. Their names have not been made public. Their families have not spoken to the media. But these were preventable deaths in a country with universal health care and free vaccine access. Think about what this means. 2 families planning for babies. 2 nurseries never used. 2 funerals instead of birth announcements. Over 5,100 confirmed cases, 2 deaths, thousands of exposures, millions spent on outbreak response. All preventable. Canada doesn't have one healthcare system. It has 13. 1 federal that breaks off into loose 10 provincial, 3 territorial. When the outbreak began, public health officials couldn't see the full picture. Each province controls its own vaccination records. There is no unified national system. During the outbreak, identifying vulnerable populations required provinces to manually share that data. The process was slow. By the time comprehensive information was available, measles was already spreading across multiple provinces. Dr. Bowdish explained the data problem. Not having a national vaccine registry means many people can't easily find out if they're up to date on their immunizations if they were vaccinated in another province or country. Here's what that looked like. A child vaccinated in Alberta moves to Ontario. Ontario can't access Alberta's records. Parents don't have vaccination booklets. The new clinic can't verify the status. The child either gets revaccinated or goes unprotected. But the deeper issue is chronic underfunding. Effective outreach to undervaccinated communities, religious groups, rural populations, marginalized communities requires sustained funding, trained staff, and trust that's built over the years. Budget cuts eroded these capacities. Community health workers were let go. Outreach programs scaled back. When COVID hit, Manitoba and Quebec created mobile vaccination clinics that went directly into communities. Walk-in appointments, multiple languages, no health cards required. It worked. But those programs were temporary. When the emergency funding ended, so did the programs. Dr. Bowdish's assessment was blunt. It is an embarrassment that with all our resources, we weren't able to stop the resurgence of measles. The return of measles in Canada shows how many systems will have to be fixed for us to get this under control. Recovering an elimination status isn't necessarily complicated. Dr. Bowdish had laid out what was needed. There's no two ways about this. This will take money, a lot of money, and a lot of investment, and it will take a lot of political will. First, make vaccination accessible. Manitoba and Quebec showed the way during COVID. Vaccination clinics in community centers, shopping malls, churches, community members who spoke the languages, evening and weekend hours, no appointments or health cards required. Both provinces contain measles outbreaks more quickly than provinces using traditional clinic-based approaches. Second, build a national vaccination tracking system. Not federal-controlled healthcare. Provinces would still deliver care, but a shared database allowing real-time identification of coverage gaps and rapid coordination during outbreaks. Lastly, toughen exemption rules. Dr. Bowdish noticed, one of the things that my colleagues and I have been saying for a long time is many of the provinces, including Alberta and Ontario, the epicenter of these outbreaks, we're way too liberal with our exemption rules, and that has contributed to falling vaccine rates. Paul Rhoda, former CDC measles chief, estimates Canada could recover elimination status probably in 12 months. Venezuela and Brazil regained elimination status in 2024, 5 or 6 years after losing it. Canada can do it faster. Before the measles vaccine was licensed in 1963, more than 2 million children died from the disease annually. The MMR vaccine is 93% effective after 1 dose and 97% effective after 2 doses. In Canada's outbreak, fewer than 10% of the infected individuals had been fully vaccinated. The vaccine works, that's not in question. What's changed is access and trust. Dr. Barbosa's organization confirmed nearly 12,600 measles cases across the Americas in 2025, a 30-fold increase from 2024. The mass majority, 95%, were in Canada, Mexico, and the United States. 28 deaths. 23 in Mexico, 3 in the US, 2 in Canada. Multiple countries are either losing or at risk of losing measles elimination status. This is not some sort of isolated failure. It is a systemic pattern. Canada achieved measles elimination in 1998 through decades of coordinated public health efforts, and maintained that status for 27 years. Lost it in 12 months. 2 infants who never got the chance to be vaccinated are dead. Dr. Barbosa's message was clear. This loss represents a setback, but it is also reversible. Until measles is eliminated worldwide, our region will continue to face the risk of reintroduction and spread of the virus among unvaccinated or under-vaccinated populations. And he added, as a region, we have eliminated measles twice. We can do it a 3rd time. The tools exist. The vaccine's safety and effectiveness are well documented. Canada demonstrated it, knows how to reach under-vaccinated communities during COVID. What's required now is political will to sustain these efforts beyond emergencies, fund public health infrastructure consistently, and rebuild this eroded trust. 2 families are living with losses that didn't have to happen. The question is whether that'll be enough to change how Canada approaches public health. or whether we'll wait until the next outbreak to care again.